Hi, I'm Dr. Jessica Williams. I'm a non-invasive cardiologist for Northwest Medical Group. Hello, today we will be talking about atrial fibrillation or Afib. What is Afib? Afib is an irregular heart rhythm issue. Basically, your heart has 4 different chambers, and the conduction starting at the top 2 chambers of the heart is irregular, which causes your heartbeat to be irregular. Some folks or some people describe symptoms like chest pain, fatigue, shortness of breath, especially when they exert themselves, and some people develop lightheadedness when they are in Afib. So as a cardiologist, we get concerned about our patients being out in cold weather. When it's extremely cold, it puts your body under a stress. So your heart responds to that by sometimes constricting the blood vessels of your heart. Sometimes your heart can become so stressed that it can cause irregular rhythms or exacerbate irregular rhythms like atrial fibrillation. So usually we advise our patients, especially patients who have a history of heart disease or there's a possibility of heart disease, we advise those patients to be very mindful of the weather, try to dress warmly, try to stay from outside in extremely cold weather conditions. So if you have atrial fibrillation or you feel like you may have some of the symptoms that correlate with atrial fibrillation, it would be best to discuss your concerns with your healthcare provider just to make sure we catch the issue and try to treat it as quickly as possible. The issue with this type of rhythm is that when those chambers are beating irregularly, clots can form inside of one of the heart chambers. Those clots can go to the brain and cause stroke. So we're usually very aggressive about treating atrial fibrillation. So again, if you have any concerns or if you've been diagnosed with atrial fibrillation in the past, definitely you want to make sure you check in with your healthcare provider just to make sure things are stable.